kid is born. His name is Alex Lang, calling him Baby Alex, which makes sense. He has a pre-existing condition, and he won't be covered. You know what his pre-existing condition is? He's too fat. Okay, but he was born that way, right? Like, sorry, a pre-existing condition inside the womb. We're not going to cover him, okay? Now, I want to show you a little news report on this because it's so amazing that you're like, no, come on, that couldn't be true. And you're going to hear someone justifying it inside the news report. Then I'll come back and tell you more amazing facts about it. All right, let's check out the story of baby Alex.
Imagine having a perfectly healthy 2-month-old baby and having your insurance tell you that they won't cover him. Well, baby Alex is perfectly healthy with no pre-existing conditions, but because of his size, he was turned down for health insurance. His height and weight put him in the 99th percentile according to CDC guidelines, and the insurance cutoff is at the 95th percentile. Dr. Speedy with Rocky Mountain Health Plans admits that it's a flawed system.
Unfortunately, when we try to sell people insurance, we have to, a number has to be used as a cutoff.
Dr. Speedy says your weight is not an absolute determinant of health, but since insurance is based on statistics, companies have to go on what works for the masses, not for the individual. Dr. Speedy says this is just one more reason his industry is leaning toward health care reform. Cute little baby.
Cute little baby denied. Okay, his industry's leaning towards healthcare reform? I must have missed that one. It seemed to me that they were leaning against reform. And I love that justification. Well, we had to do a cutoff somewhere. No, you didn't. How about you could have covered all the babies? Is that crazy talk? No, we had to deny some people. I mean, we had to deny at least 5% of the people because, you know, those babies were born too fat. By the way, if you think I'm being impolite with that language or that I'm adding weight to it, if you will, no, they actually literally, here's what happened. First, they have the baby, and their insurance says, oh, we're going to raise your rates 40%. They're like, come again, are you kidding me? They're like, no, your baby's, we had no choice. It's in the 99th percentile. Raise them 40%, right? So they go looking for a new insurer, and their new insurers say, I'm sorry, but he has a pre-existing condition. He's a fat ass as a baby, okay? And they literally called and said, quote, your baby is too fat. Okay, so Bernie Lang is his father. I love this guy. You know what he said? He's breastfeeding. We can't put him on the Atkins diet or on a treadmill. He's a baby. Well, seriously, what are they supposed to do? No, we had to do a cutoff somewhere. We had to deny some of your babies. What were we supposed to do? Cover all your babies? Of course we're not going to do that. How else would we make money? And these are the guys we're supposed to trust? No, don't worry. You don't want a public option or anything like that. The private insurers will take care of it. Unless your baby's too fat, in which case they won't. It's not like they fed at McDonald's. They didn't do anything. It's just breast milk. He was born that way. Hey, you better not have a baby that's too fat. I don't know if you can control it or not, but sad day for you. Otherwise, 40% hike. Do you know what a 40% hike in your insurance is? It's only enormous. And if you want to get new insurance, forget about it. You're done. Gee, do we need healthcare reform? Chair, I can't figure it out. Do we need healthcare reform? Or these guys, they're on top of it, right?
What you do is, well, at least this is what I'm going to do. You stay away from fat people. You don't marry them. You don't have babies with them. Your kid's going to be thin, right?
Well, yeah.
Hey, Wendy better watch out.
Hey, wait a minute.
More now on the fight over Obamacare. The president's health care overhaul was supposed to rein in costs. After all, it's called the Affordable Care Act. But Chief National Correspondent Jim Engel tells us tonight about a Kentucky family that begs to differ.
Andy and Amy Mangione and their 2 boys are just the kind of people who should be helped by Obamacare, but they recently got a nasty surprise.
When I saw the letter when I came home from work, your action required benefit changes and closed Act Now from my insurance carrier.
And it had stunning news. The insurance for the Mangiones and their 2 boys, which they bought on the individual market, was going to almost triple in 2014 from $333 a month to $965 a month. And the insurance carrier made it clear the increase was in order to be compliant with the new health care law.
This is a high deductible plan where I'm assuming a lot of risk for my health insurance for my family, and nothing has changed. Our boys are healthy; they're young. My wife is healthy. I'm healthy. Nothing in our medical history has changed to warrant a tripling of the premium.
I'm going to have to figure out where we're going to cut, what we're going to do to afford $1,000 a month medical insurance premium.
His insurance company, Humana, declined to comment, but the notice to the Mangionis carries this paragraph saying, quote, "If your policy premium increased, you should know this isn't unique to Humana. Premium increases generally will occur industry-wide. Increases aren't based on your individual claims or changes in health status," it continued. "Many other factors go into your premium, including ACA compliance, including the addition of the new essential health benefits." ACA, of course, is the abbreviation for the President's new law, the Affordable Care Act, which for the Mangionis will be anything but affordable because the law taxes every insurance policy and requires a list of additional benefits the Mangione family didn't want to pay for.
For people who currently choose to purchase a high deductible, low premium policy that's more affordable for them, they're now being required to add all these new benefits to their policy. That's also going to add to the cost of their health insurance premiums.
There's a huge debate over whether Obamacare will raise or lower insurance rates. For this family, that answer is abundantly clear in black and white. In Louisville, Kentucky, Jim Angle, Fox News.